Hi everyone, today we're going to be talking a little bit more about treating forefoot conditions, and for me, sesamoiditis, plantar plates, Morton's neuroma, they're all very similar in how I treat, and being a small area, I present it basically as the same. And so today we're going to state sort of patient positioning, the different protocols that we're using for forefoot conditions, and then build out from there. And hopefully this gives you a better idea of, a more fuller understanding of how we approach these types of conditions with regards to PBMT, and so that you get a bit of a greater understanding of how to put that therapy into place in conjunction with everything else that you're doing in your clinic as it is. Now for me, I definitely like to tilt my patients right back, put them high enough so that I can just go straight onto their area, do a double check of how their symptoms are going, and then put the laser therapy PBMT into place. For me, with the example of the sesamoiditis here, you can see that I'm really focused with sort of some anti-edema, anti-swelling over that first MTP complex. Okay, from there I'm then going to sort of make sure that I'm reducing any contracture along the muscles, and whether that's the plantar fascia, and that could potentially be right up into the FHL muscle belly as well. So do consider that, and whether you need any trigger points there too. Now the slight differences come when you're looking at the plantar plates or into the Morton's neuroma. Obviously you're going to focus onto those areas and potentially more broadly to make sure that we're removing the edema, but also along that area you're reducing any contraction that may be leading to the concerns that your patient is experiencing. So let's take a little bit of a look at that with regards to the sesamoiditis. You can really see here that we're just focusing initially with the swelling over that sort of more broad sesamoid area, and that's going to be really effective at bringing the pain back down and putting them into a much better position. Now you're seeing a little bit more of the contracture here, and hopefully getting into a good position where we're reducing that contracture and really taking the pressure off that first MTP apparatus. You can see that it's quite broad. Also considering doing the trigger points, as I mentioned, through some of those muscles, making sure that you're releasing anything that could be causing concerns, so that we don't have extra aspects that we don't initially think about slowing our healing. I found that this works really, really well, and particularly for sesamoiditis, they don't need too many sessions. But where your patient's pain, is, think more broadly about that. Think about the biomechanics, the offloading. Think about whether you need some eccentric strengthening as well. But overall, what we're wanting to do is reduce the edema, the contractures, heal that tissue more effectively. And the only way we can do that is by looking and treating holistically. So really keep that in mind there too. But this has been forefoot conditions. Look at that sesamoiditis, plantar plate, Morton's neuroma. Treat them very similarly in how you approach. And I've typically found that looking locally and then coming more proximally is a really good way to go. But hopefully this helps you on your path to pain-free patients. Cheers.